CD19 is because they contain the specificity for CD19 on the B cells. Another important item about the T cells were that they included a CD137 signaling domain. The reason this is important, previously researchers had developed chimeric antigen receptor T cells, but they found that once they were infused into the patients, they were not able to survive for a very long period of time, and their function was limited to a very short window, so they didn't get the effects from those T cells that they had hoped for. And so again here we're just showing this is a tumor cell with the CD19 on its surface. Here's a genetically modified T cell receptor that is attracted to the CD19 marker on the B cell. So how did the researchers get this genetic material into the T cell? They used an HIV lentiviral vector, and this was an HIV virus that had been deprogrammed so that it was not infected anymore. And then they picked the DNA that they wanted and used this vector to insert the DNA into the T cell. So the variable region right here would be what would be on the surface of the T cell, and then you would have your T cell membrane, and then intracellularly you would have the CD137, and you would also have the CD3 zeta chain, and this is what signals inside the T cell. So I want to give you a little bit of patient history. All three patients in the study were males. Their ages ranged from 64 to 77. Patient 1 was initially diagnosed in 2000 with stage 2 CLL. And basically the information that I wanted to show you here was that you can see that from 2002 to 2010, this patient received various types of chemotherapy drugs, and he also received multiple cycles of chemotherapy treatment. Patient 2 was also diagnosed initially in 2000. He had a stable disease for 4 years, and then it began to progress. In CLL patients, sometimes when they're diagnosed, they may not require chemotherapy treatment right away. Other patients will require chemotherapy as soon as they're diagnosed, so it depends on the individual. This patient also had the P53 gene mutation that we talked about earlier. And from 2007 to 2010, when he entered this study, he also had multiple cycles of chemotherapy treatment. And patient 3 was initially diagnosed in 1996. He also had the P53 gene mutation that we talked about. And as you can see from his chemotherapy treatment from 2002 to 2010, he also had several cycles of chemotherapy. And he also developed an allergic reaction to rituximab, which is one of the chemotherapy agents that was used. So all three of these patients had underwent multiple rounds of chemotherapy. They were no longer responding to the chemotherapy. So that's why they were enrolled in the study, is basically they were out of options for treating their disease. So the method that was used prior to infusion with these CART19 T cells, each patient was given a single round of chemotherapy a week prior to their infusion. And this was to deplete the remaining lymphocytes in their blood, so that when they were infused with these genetically altered T cells, then they had a clean slate to start from. Also, one thing that I wanted to point out, this shows that the total dose of CART19 cells that were given, this was based on per kilogram of body weight. If you'll notice, patient 3 had a much lower level of CART19 cells that he was infused with. And this was due to the progression of the CLL and so researchers were unable to retrieve as many T cells from his blood as they were for the other two patients. The CART19 cells were then infused into the patient, and they used a split dose regimen. On day 1, they were infused with 10% of the CART19 T cells. On day 2, 30%, and on day 3, 60%. The reason the researchers chose to do this was to limit the number of cytokines that would be released in response to the CLL cancer. So what were the results that they found? After the patients had been infused with the genetically altered T cells, they didn't see any immediate effects or no toxicity effects. However, 2 weeks later, the patients began to experience fever, chills, fatigue, a drop in blood pressure. And this sounds like something bad is happening to the patients, but this is actually the T cells working against the cancer. And this produced a tumor lysis syndrome in some of the patients as well, which was from so many of the cancer cells being killed off. Sometimes this can cause acute kidney problems, and this required hospitalization and treatment for some of the patients. So on this slide, you can see this is the percent of white blood cells. The days after infusion are across the bottom. So at day 0, you would have no CART19 T cells in the blood. Then they were infused, and you can see that the cells expand. And then what's interesting is around day 80 out to day 180, you see that the CART19 T cells kind of stabilize, and so this shows that they were able to proliferate in the patient, and that they were also able to remain functional in the patient for several months after they were infused. Researchers estimated that the CART19 cells expanded 1,000 to 10,000 times inside the patient. They performed CT scans on the patients prior to the study, and then also at 3 months and 6 months in the study. So they had a baseline CT scan, and then 83 days after the genetically altered T cell infusion, lymph nodes that had been previously swollen had reduced in size. So I have a slide of the CT scan for patient number 1. This is his baseline scan. These are a bilateral axillary view, which means that it's about at the armpit area of the patient. So here you would have the scapula, the spine, same here, the scapula, the spine. These would be the ribs. And you can see at the beginning how swollen the lymph nodes are here, and then they had a drastic reduction in the size of the lymph nodes at day 83. Two of the 3 patients in the study had a complete remission, and this is ongoing 12 months after the study. No CLL cells were found in the blood or the bone marrow 1 month after infusion. One thing that I thought was interesting was that the research was able to calculate that for every 1 genetically altered T cell in the patient, that T cell was able to kill 1,000 CLL cells. And all 3 patients in the study experienced a loss of 2 pounds of cancerous cells. One patient had a partial response. This was patient number 2, and during his symptoms of the tumor lysis syndrome, he was taken to a different hospital because he was experiencing cardiac dysfunction, and was given steroid treatments. And so researchers believe that the steroid treatment may have hindered the ability of the CART19 T cells to function as well as it did in the other 2 patients. So this brings me back to my hypothesis that genetically altered immune cells are a more effective treatment against CLL than chemotherapy. While the results of this study were positive, they did indicate that the genetically altered T cells were able to expand and continue to function for over a 12-month period due to the increased cytokine levels that the patients experience with such a small dose of these T cells. I think further study has to be done, and also in a larger study group as well. But definitely further clinical trials are warranted.
I have two questions. First of all, if you took this injection, do they have any way of knowing what the effect would be when you inject a healthy individual? Would there be the fever or chills, or is that a side effect that's purely due to the presence of cancer being in the body and the cancer being received?
The way that I understood the study, the effects that the patients experienced was due to the genetically altered T cells were attacking the cancerous B cells and releasing cytokines, and these cytokine levels were what was causing a lot of these effects in the patient, such as the fever and the chills, and it was due to some of the cancer cells being destroyed at one time and the body trying to get rid of those cancerous cells.
Did you see any indication that prior to introducing this drug in the trial study that there had been studies with animals that might have shown where they would have had healthy animals and animals with cancer to see whether that is the case? Any evidence there?
They did do studies. Studies were done in mice. I'm not sure if they did the studies in healthy mice or only mice that had the tumor cells. And that's why they chose to inject the patients with such a low dose of these genetically altered T cells. They were able to study the response in the mice and then compare the mice with the human body. So they chose to do a much lower level of the genetically altered T cells because they were trying to test the safety of this method. Ariel?
So that CLL was caused by a mutation of the P53 gene, right? What can cause that?
The P53 gene mutation can be caused by a lot of different factors. It can be caused by viruses or exposure to chemicals. So the DNA mutation can come from a lot of different methods.
Did they indicate anywhere that CART19 would be flushed out of the system once the treatment is over, once the lymph node swelling goes down, once the cancer cells count goes down? Is it desirable to actually flush that CART19 out of the system, or do you want to actually have it in the system and linger in there?
From what I understand, they actually want the CART19 cells to remain in the system. They wanted them to become memory cells so that they could continue to attack the B cells or the cancerous B cells in the patient, and so they were looking for a long-term persistence. However, they're still monitoring the individuals in the research to see how long these cells are going to persist, because one of the issues is with these CART19 cells, they kill off the healthy B cells as well as the cancerous B cells. And so these patients require every few months an injection of immune globulins to protect them from infections.
Did they admit to the fear that one of these CART19 will accumulate further mutations and then go rogue and start doing things that they're not supposed to do? Did they mention about that risk?
I don't recall that they did.
Is this disease hereditary?
I don't